Child welfare professionals are often focused on preventing and treating intentional injuries from child abuse and neglect. But they're also interested in addressing unintentional injuries like burns or poisonings or falls. This study used data from the 2010 National Survey of Child and Adolescent Well-Being to figure out what factors and characteristics put children at risk of unintentional injury after they were placed in different living situations following an investigation from Child Protective Services. The authors found that children were at higher risk of injury if they lived in places after the investigation that were not monitored for safety. So that includes children who continued to live with their parents, or who were reunited with their parents after a stay in foster care, or who lived with family members who were not licensed. Also, children with behavioral problems had an increased risk of injury than children without behavioral problems. But this risk of injury was less for children who lived with family members or foster families after the investigation compared to children with behavioral problems who continued to live with their parents. Injury prevention programming is really important for the child welfare population and can be tailored to different household characteristics, which can be really impactful, particularly for caregivers of children with behavioral challenges.